Oh, Linda from Massachusetts. We're neighbors. Hello. Maryland. Hello. Teresa.
Hi, Linda. All right. All right, so I will get us started. Thank you again, everyone, so much for being here. If we have not met before, my name is Michelle Grasek, and I'm an acupuncturist in upstate New York. I have a practice where I specialize in cosmetic acupuncture, and I'm also the host of the Acupuncture Marketing School podcast, and I teach PDA credits. And I am really so excited to host this class with Dr. Krystal Couture, who is a doctor of physical therapy and a licensed acupuncturist. And her specialty is acupuncture for pelvic floor. And I only recently discovered pelvic floor therapy and felt that it was life changing and that so many more people need to know about it. And have had several family members who also have had just enormous improvement in their quality of life from pelvic floor care, but it is not something that is talked about a lot. It's becoming much more popular recently, which is very exciting. So I think that, the more we can talk about it, the more we normalize it, the more our patients are willing to give it a try and talk to us about it as well. And learning from Dr. Couture about all of the incredible ways that acupuncture can really help the pelvic floor just made me want to participate and help her bring her message to more people. So she is going to teach us an introduction today. She has a lot of great slides to cover, and I think we should have some time for Q&A at the end. So welcome, Dr. Krystal Couture. Thank you so much for being here.
Oh, thank you so much for having me. And thank you to everyone for being with me and sharing your interest in pelvic care and entrusting me to provide you with a little bit of education. Let's get into the slides. There we go. Okay, so you should be able to see my screen now. Give me a thumbs up if you can. Yes, perfect.
Yes.
Awesome. All right, so here we are. This class is called Pelvic Care for Acupuncturists, and this is our introductory course. Of course, it's hosted, as you know, by the beautiful Michelle Grasek, and I'm Dr. Krystal Couture. In case you don't follow us on social media, I'm the Pelvic Acu, and Michelle Grasek is at Michelle Grasek. You can go ahead if you want to. If you like connecting with other participants, go ahead and put your Instagram handle into the chat as well, because we're more than happy to connect with you. All right, so let me tell you a little bit about myself and how I started with pelvic acupuncture and really pelvic PT, because that was my starting ground. So I started off as a holistic PT, and I went through the process of learning dry needling before it was cool. I was like the second person certified in the state of New Hampshire. And that was when you had to do 200 hours per body part. So I really got an awesome education with that functional needling of muscle-specific ashi points, right? That's how we know them in Chinese medicine, and that's what the PTs call dry needling, right? So I started off in that realm, really doing a lot of needling and really doing a lot of manual therapy, getting into space with clients on a deep level and connecting with them emotionally, connecting with them physically, and helping support them with pain. That was kind of my niche. And then as we got closer, clients and I, they started to bring up more intimate concerns. They started to talk about their pelvic health. And this was before pelvic health was mainstream. There weren't a lot of pelvic PTs out there. There weren't really classes for pelvic PTs. It was kind of like a topic that no one really wanted to talk about and was just something like, oh, that's normal with aging, right? Which I hate it when that's the response that our clients are receiving. So as this started to happen, I started to research everything that I could and learn as much as I could. I took classes that were for urologists. I took classes that, were for gynecologists, just so that I could gain some insight. And I started trialing different methods in working with these clients. So fast forward a little bit. My medicine very quickly became something that did not fit in the box of the physical. it really became something that was emotional, that was spiritual. And, the sinews were kind of calling to me before I had a name for them. And points were calling to me, and I didn't really understand what was happening. So I started learning about Chinese medicine, and here we are, I'm an acupuncturist. So then, as an acupuncturist and a PT with lots of women's health, lots of men's health, and lots of pelvic floor, pelvic care, pelvic health clients, right? I start developing a methodology that bridges together what we do as acupuncturists so well, which is the weaving together of the body, the mind, the spirit, and the emotions, and creating a system that clients with pelvic care issues would feel really comfortable in all realms. And we would start to see the trajectory of process be on all levels instead of one level. And what I found is that is a far more successful methodology than, just treating one, right? This is kind of our foundational philosophy as acupuncturists. I feel like this is an easy conversation to have with acupuncturists, so I won't spend more time on it. But it was really fascinating to me to kind of bring this through my process. I want to know why you're here. So you can pop your number into the comments section. One, do you already perhaps have a practice that's women's health, men's health, sexual health, and you already know, like, I want to bring pelvic care to my practice right now? Or number two, do you want to heal your own pelvis? Is that what you're looking for? Are you looking for some help with what's happening in your own body to then see where it goes? Or three, are you kind of looking for both? Right? Are you looking for some combination of what's happening within your own body, and also you want to bring it to your practice? Okay, so we're seeing bring it to your practice, we're seeing both. So combination, right? That's awesome. We're in the right place together. Let me tell you about my process. And this is my class. I don't want to make this an advertisement, so I'm going to go really quick here. But of course, in 1 hour today, you're probably not going to go back to your clinic and be like, oh, I can treat all the pelvic care clients. I'm 100% confident to, use this process, right? You're going to get just a taster. And so in my advanced pelvic care certificate, what you get is a full lesson on the anatomy and physiology of the pelvis. We talk about pelvic pathology from the TCM and the Western perspective. We use those most common diagnoses and those most common patterns and kind of look at how they integrate together. This gives us the opportunity to talk with other practitioners and also talk with our clients in the lingo of the Western mindset and the Eastern mindset. We also talk about spirit of the points of the pelvis, which is so key for treating the emotional conditions associated with pelvic health. Complementary techniques, which of course are going to be like our at-home programs to share with clients, Chinese nutrition for the pelvis, our treatments and our protocols, which is like a 6-hour course on doing a lot of that muscle-specific ashi point needling of the pelvic floor, and also the concomitant structures, as well as weaving that in with our TCM patterns, our spirit of the points, etc. Put the whole thing together, wrap it up with a bow, and we can treat our clients, right? And then of course, ethics class and safety class. In addition, my pelvic care certificate also brings in that practical component. So you learn with me in a small group setting, and we do our hands-on practical experience. So you get to practice everything that you've learned and ask questions, and we get to work it out together. And then you get some bonuses, like some email templates that you'll be able to send to your clients once you bring this in, and of course, a whole bunch of social media templates. All right. Exciting news. Our first live practical is actually coming up. It is November 9th and 10th in Hallandale Beach, Florida, which is situated right between Fort Lauderdale and Miami. So that's super exciting. I'm really excited about that. And I was super excited to see that so many of you are in Florida. We're also going to do a practical up here in New Hampshire, October 12th and 13th. And go ahead and pop into the comments if you have a dream study that is not New Hampshire or is not somewhere in Florida where you would like to see pelvic care. All right. What do we have here? Rochester, New York City. I love that. New York City. Seattle, Washington, Alberta, Canada. All right, we'll have to do some work for Canada because I think the credits are a little bit different, but I love that. Montreal's close by. I don't actually know where Calgary is. geometry is really bad. Geography. All right, cool. Thanks for giving me those ideas. And we'll see what we can do. So what are we going to do today? We are going to cover, first off, what is the pelvic floor? We're going to go into the anatomy, the function, common pathologies. We're going to touch and scratch the surface of TCM patterns, but as you know, we can't go into great depth in an hour. We're going to talk about the need for support in pelvic care. We're going to talk a little bit about quality of life, and then we're going to talk just a teeny bit about some acupuncture pelvic health research that's already out there. And then we'll talk about treatment techniques, tools in the toolkit, the pelvic breath, which is my go-to for exercise number one, getting people connected to their body, helping them to understand their pelvis a little better. And we'll talk about some lifestyle changes or supports that clients can bring in to really support them. And you'll be able to start to bring some of these in now if these clients already exist in your practice. So what is the pelvic floor? Well, first off, everyone has a pelvic floor, right? The pelvic floor is a group of muscles, tendons, and ligaments that connect the bony structure of the pelvis to create this hammock or basket-like support for the bladder, the uterus or womb, and the bowels. You're going to see the slides for the anatomy portion of this presentation, but I actually think it's a little bit more helpful if I use my anatomy demo model to just give you some more information and kind of give you this 3D version, okay? So here is our bony pelvis. We're looking at it, you're looking at it from the anterior to posterior view, right? So we've got our iliac crest, okay? And we go in, and this is going to be our ASIS. Then we're going to follow those iliac crests down to the pubic bone. The pubic bone meets at the pubic symphysis, okay, right here. That's a little cartilaginous joint. When we flip to the back side of the pelvis, once again, of course, we've got those iliac crests, right? We can see the sacrum. And actually, this model is awesome because we can see the sacral foramen really nicely. And of course, we're going to follow that down, and we've got the coccyx or the tailbone, okay? So that's our bony structure of the pelvis. We don't have a lot of time to go into the ligamentous structure today, but I am going to point out, one more thing on the bony. We've got the ischial tuberosities or the sit bones. And actually in this view, you can see the ischial tuberosities, you can see the coccyx up top, and you can see the pubic bone, right? So those are the 4 bony prominences that help to support this hammock or basket-like structure of the pelvic floor. With me so far? Yes? Awesome. Okay, so now let's look at our musculature, and we'll talk about that one ligament I mentioned. From the sacrum down to the ischial tuberosity, we have the sacrotuberous ligament. It's painted kind of like it's a muscle in this model, and like every model I've ever seen. It's not a muscle, it's a ligament, and it's very important to what we're doing with the pelvic floor because of this connection. It's also really important if you've got a client that has an SI joint dysfunction, because you can see that can definitely create torque on those SI joints, right? So super important ligament there. Okay, into the musculature that is connected. First up, we've got the piriformis coming off of the sacrum. That piriformis is going to be a muscle I'm sure you've heard of, right? Piriformis syndrome, my piriformis is pinching my sciatic nerve, etc. That's going to come up in pelvic care as well. The other muscle we're going to talk about here is the coccygeus muscle. It is much less commonly talked about, I would say, but it is a very, very important muscle. It comes right off the coccyx and actually lines that whole lateral aspect on both sides of the coccyx. It's a great, great muscle to work with. Okay, so I'm going to flip my pelvis over. There we go. So now what we're looking at, we're going to do the superficial layers of the pelvic floor. Okay, so here we have, this is the perineum. So underneath the perineum here, we've got the external anal sphincter. Above it, we've got the vaginal opening. This is my female pelvis. I didn't bring a male today. So from the perineum, this is the transverse perineal muscle, okay? Coming up on that pubic ramus, we've got the ischiocavernosus muscle. And then working right here along the sides of the vaginal opening, we're going to have the bulbospongiosus muscle. Okay, so that's the superficial layer of the pelvis pelvic floor muscles. Now, when we palpate these, they're going to be very superficial, like more superficial than you think. So you want to have a nice light touch. Now, if we look at the deep layers of the pelvis, okay, again, here's our external anal sphincter. Then the next layer that we're going to see right there, I think that's a good view, is the puborectalis. And then we've got the pubococcygeus, and then we've got the ischio-coccygeus. So when we work with palpating the deep layers of the pelvis, I actually like to have the client in this side-lying position because it's very easy to use my fingers to palpate each of those lanes. So, right, the puborectalis is a middle lane, right, or the medial lane. The iliococcygeus is going to be the most lateral lane, right? So it's kind of a nice orientation. But it's great to have a pelvis with you if you're doing pelvic care because you can explain things to the client. And also you'll be able to kind of really get that 3D sense and that modeling of what's kind of happening with the pelvis. And you'll always kind of have an orientation. Everybody's pelvic floor is going to look different. Everybody's pelvic floor is going to feel different. And you're going to see lots and lots of differentiation in the anatomy with the rectum, with the perineum, and also, of course, with the vaginal opening, with penis, etc. It just looks different. Things will surprise you, and that's okay. This is what we're into here, but everything looks different and definitely at different stages of life, right? Through menstruation, through pregnancy, through postpartum, through menopause, we're going to see some different changes down here. So we want to be aware of that. So getting as familiar as you can with the pelvic floor anatomy is really, really key. All right, let's go back to the slides, if I may. There we go. All right, so you've got all those slides for your review. For now, let's talk about how the pelvic floor functions, okay? So first up, we talked about this sort of hammock-like structure, and you can see this with the pelvic floor, right? The musculature kind of hangs below the bony structure. So it creates this hammock. What that is designed to do is support the organ systems of the abdomen, right? It keeps them in optimal alignment. Of course, we've got fascia that helps with that process, but the pelvic floor itself is a huge, huge component in keeping everything up and in. So now the pelvic floor is going to be activated in conjunction with the abdominal muscles and the muscles of the back, right? Whenever we're doing lifting or bending or carrying or jumping or any kind of power activity as well. What happens during these activities is they can actually increase the pressure in the abdominal cavity. And the pelvic floor is particularly important in staying in a tonified or supple state so that it can keep those lower abdominal organs from being pushed out and prolapsed, right? So that's number one for pelvic floor function. Number two, let's talk about sexual and reproductive function. In women during sexual activity, the pelvic floor muscles help to increase the blood flow to the genitals, thus promoting arousal, lubrication, ease of penetration, and even orgasm. So when we're talking about pelvic floor, we also want to be very aware that we're going to be talking about sexual health. They go hand in hand. In men, of course, similar thing happens. The pelvic floor muscles help to manage the blood flow to the genitals by compressing those penile veins and trapping the blood inside the penis to create the erection, right? As far as urinary and bowel function goes, the pelvic floor, of course, houses the openings for the urethra, the bladder, and the anus, right? So if I go back to my model here, hope you can see this. All right, so again, pubic bone at the top. So then we're going to have the opening for the urethra. We're going to have the vaginal opening, and we're going to have the rectal opening, right? Okay. So the pelvic floor, what it does is it actually helps to close these openings to prevent leakage and relax them for the emptying process. So contracting to prevent the leakage and relaxing to allow, defecation or urination, right? So the pelvic floor really supports that continence of bowel and bladder in men and women. Let's do a quick run through the most common pathologies that I see. in my pelvic care practice. So first off, let's talk about some urinary disorders. We're going to see incontinence, which is involuntary leakage of urine. We're going to see frequency. We're going to see retention, difficult urination. We're going to see dysuria, which is pain on urination. Hematuria, which is blood in the urine. We can see recurring bladder infections or urinary tract infections, also interstitial cystitis, and we can see neurological conditions. As far as the rectum goes, we'll also see some rectal disorders. So we can see incontinence, we can see pain, we can see constipation, diarrhea, and hemorrhoids, okay? We also have conditions that are specific to those assigned female at birth, AFAB, those assigned male at birth, AMAB. So under those assigned female at birth, pelvic pain and dysfunction kind of falls into several categories, and we're just going to touch the surface. Endometriosis, fibroids, vulvodynia, yeast infections, painful intercourse, pudendal neuralgia. We'll also see prolapse conditions, such as the bladder, the rectum, and the uterus, or the womb. In those assigned male at birth, we can see pelvic pain, which is pain on its own, otherwise undescribed pain, right? Unspecified pain, that's the word for it. Or chronic pelvic pain, CPP, which is pain lasting longer than 6 months of unidentified origin. Prostatitis, pudendal neuralgia. Then there are pelvic dysfunctions that we can see, such as erectile dysfunction and Peyronie's disease. So what TCM patterns are we going to see in correlation with these Western diagnoses, right? Well, on the urinary level, we can see kidney qi deficiency, we can see damp heat, kidney yang deficiency, kidney yin deficiency, spleen qi deficiency, and liver qi stagnation. And you're probably starting to see how some of these already kind of work their way through, right? How they sort of make sense with these diagnoses we already talked about. With the bowel, we'll see large intestine cold, large intestine damp, liver fire and salting the lung, liver invading the spleen, spleen qi deficiency, and spleen qi sinking. Those assigned female at birth, qi stagnation, damp heat, spleen qi sinking, liver qi deficiency with stagnation, kidney yang, kidney yin, and spleen qi deficiencies, right? With those assigned male at birth, we can see liver qi deficiency with stagnation, kidney qi, kidney yang, kidney yin deficiency, once again, damp heat, and qi stagnation. Now, of course, we can see any TCM pattern, and we can see any pelvic pathology or diagnosis. And certainly we don't have the time to go into some of those intricate details, but these are the most common that I see. So that's what I wanted to share with you today. We're going to talk about 4 pathology and pattern integrations: spleen qi deficiency, kidney yang deficiency, damp heat, and then liver qi deficiency with stagnation. First up, spleen qi deficiency. So we can see spleen qi deficiency with urinary conditions such as frequency, retention, UTI, interstitial cystitis, with bowel conditions, of course, such as hemorrhoids. We can see AFAB conditions such as yeast infections with spleen qi deficiency. Once again, any pattern, any diagnosis or pathology can be linked together. This is just a generalized approach. All right, so what is spleen qi deficiency? Most of us know spleen qi deficiency well, especially if we're from the Northeast. Spleen qi deficiency, as we know, is primarily caused by this excessive worry or excessive mental activity, right? The brain on the hamster wheel, the rumination. Irregular diet or prolonged illness, especially autoimmune conditions, can really impact the spleen qi as well. The energy of the spleen, right? It ascends, energy of the stomach descends, energy of the spleen ascends. This creates an equilibrium for the descent of turbid waste, right? The spleen is that governor of transportation and distribution. So when the spleen qi is ascending, turbid waste can descend. That's great. But when the spleen qi is deficient, clear and turbid can become mixed, and thus neither ascend or descend. So we end up with some kind of stagnation, and our body's really not sure on what's going on there. So some concomitant conditions, as I'm sure you know: poor appetite, abdominal distension, sleepiness after eating, weak limbs, loose stools, and of course that yellowing of the face, right? Our pulse here is going to be weak and thready. Our tongue commonly pale and swollen with a thin or thick white coat. The connection to the pelvic floor is that there is a proprioceptive confusion, right, of that ascending and descending of chi. And this can really impact the ascending or contracting of the pelvic floor and the descending or relaxing of the pelvic floor. Some points here that we can use, of course, moxa on spleen 6 and stomach 36. We can use spleen 3, CV12, bladder 20, and bladder 21. Now, often spleen qi deficiency can overlap with kidney yang deficiency, which is why I decided to bring it in next. So kidney yang deficiency, urinary conditions that we're going to see, frequency, retention, dysuria. With those assigned female at birth, we're going to see endometriosis, and that's not only going to indicate kidney yang deficiency, it's also going to indicate blood stagnation. For AMAB, we're going to see erectile dysfunction and Peyronie's disease, which is pretty commonly known. So what is kidney yang deficiency? This is when we have a failure to support the metabolism and transformation of fluids. Weak yang is generally going to yield this poor qi movement. Some concomitant conditions, right, are going to be cold. We're going to see the backache, the low libido, infertility, dizziness, tinnitus, and that bright white complexion, right? We might also see some knee conditions associated as well. The pulse here is going to be deep and weak. It's going to be very obvious that there is that deficiency in the kidney area. The tongue is going to be pale with a white coat. The connection here to the pelvic floor is that either weakness or overactivity of the core and the pelvic floor can create this reduced kinesthetic awareness of the core and the pelvic floor. So what does that mean? Well, if the pelvic floor is either weak or overstretched, or it's overactive and overcontracted, this kinesthetic awareness means that we're not really sure what's happening in our own body. We don't know if we're in a contracted state. We don't know if we're in an overstretched state, and thus things are kind of just jammed up. So we've got a stagnant state within the core and the pelvic floor, which means that we might not have that beautiful contraction, right, to keep the urine in or to keep the bowel movement in, right? Or we might have the opposite happen as well. The points for this are going to be bladder 23 and 52, of course. Those are kidney points. Jingong, GV4, CV4, CV6, kidney 3, and kidney 7. Kidney 7. And then, of course, moxa is generally going to be indicated, of course, provided there's not some type of excess heat condition. Now, most of the time, we're not going to see excess heat if we've got kidney yang deficiency, but we could have some case of like external heat, especially when we're talking about damp. So on to damp heat. Within the damp heat category, okay, we're going to see urinary conditions, frequency, retention, pain with urination, UTI, of course. Any of those recurrent infections can be very common, but not the only answer to what's happening with the body, right? With the bowel, large intestine, incontinence, and pain, with the those assigned female at birth, pelvic pain, fibroids, and yeast infections. With males, pelvic pain, erectile dysfunction, and Peyronie's. Most of the time, damp heat with the bowel, right, is going to be in that large intestine category. Most of the time with those assigned female at birth, it's going to be the liver damp heat, but not always. So damp heat in the bladder or the local Luau channels, right? The presence of external damp heat blocks the qi transformation in the bladder, and thus it obstructs the free passage of urine and fluids. So internal damp heat can arise from a yin deficiency, qi stagnation, or that prolonged stagnation of damp. Internal damp heat presents with a more systemic symptom profile, whereas external damp heat is going to present with more localized symptoms. So we may see someone that has cold throughout their body, but does not have cold in that lower jiao region, right? So that's going to be some indication that there's this external heat. When we see the heat that exists throughout the whole system, then we'll know that might be an internal damp heat condition. Make sense? Concomitant conditions. We can have burning in the urethra, dribbling of urine, turbid urine, deep yellow urine, blood in the urine, stones in the urine, abdominal distension, and of course, fever and thirst. With the pulse, we're going to see a slippery and rapid pulse. Often we're going to see that pulse be wiry in that left rear position. The tongue is going to be yellow with a sticky coat. The connection to the pelvic floor is that damp heat, of course, can injure the yin and the fluids, which can cause this expansion or overstretching of the core and the pelvic floor, or bloating, which over time can really lead to a chronic overstretching of the abdominal muscles and the pelvic floor, which means that there's probably an overstretching on the anterior side of the body and an overcontracting on the posterior side of the belly, posterior side of the body, which means that the pelvic interaction, instead of being in a normal positioning, right, we're going to have kind of this going on. So we're going to have this anterior pelvic tilt that's creating strain on the body. And we could see, pain and other conditions in the back of the body and in the front of the body with our pelvic floor symptoms, right? So some points here: spleen 6, spleen 9, bladder 22, bladder 28, CV3, bladder 63, bladder 66, and stomach 28. All right, finally, we're just going to talk about one more TCM pathology. We're going to talk about liver Qi deficiency with stagnation. With those assigned female at birth, most commonly what we're going to see is vulvodynia. Those assigned male at birth, most commonly we're going to see prostatitis or erectile dysfunction. So liver Qi is particularly disrupted by emotions, right? Frustration, anger, resentment, any kind of emotional turmoil, long-term stress, right? That really gets into the liver and kind of makes a mess of things. Because the liver channel passes through that lower jiao, it can really impact what's happening with the bladder Qi and the kidney Qi. And it can condense fluids and hormones into this heat or damp situation. Some concomitant conditions here are going to be emotional upset. We're going to see symptoms higher up on the rib cage here. So rib, chest, abdominal distension or pain, the lump in the throat, the sighing, the PMS and menstrual irregularity. And this can turn into heat as well. So we can see that feeling of hot on the physical level, but also we can see irritability really kind of spiral and rise. The pulse here, of course, with the liver Qi deficiency is going to be wiry. The tongue will be normal to dark. The connection to the pelvic floor is that emotional dysfunction inhibits pelvic floor dysfunction. We're sensitive as acupuncturists. We understand that everything is connected, right? Just that heart-uterus connection, right? The Baomai. We know that the emotionality of what's happening in the body can impact the root of the body, right? If there's no foundation, there's nothing to build upon. So this is really important to consider. And I see this a lot with our liver Qi deficiency with stagnation clients. Points here: gallbladder 34, liver 3, liver 13, liver 14, triple warmer 6, pericardium 6, and you can add that liver 2 fire engine point if heat is generated. Now, the origin of the emotional imbalance or stress must be addressed in order to heal the dysfunction in the case of the liver. And I find this over and over again in my practice. It's actually like, that was the crux, honestly. And I didn't know what it was at the time, but that was really the crux for me when it was like, okay, I can't just treat a pelvic floor as a pelvic floor on this physical level. Like something else has to shift. And I started to very quickly find out what was it. And it was emotions. And I didn't know what it meant, but I knew it was emotions. And I knew we had to go there in order to be successful with this type of client. All righty. So enough technical stuff for now. Let's talk some statistics so that you can start to understand how big the pelvic pain and pelvic dysfunction population really is. Okay. 32% of women and 16% of men are experiencing pelvic pain or dysfunction. That's a huge number, according to the Mayo Clinic. So I think they took probably a pretty good sample size, right? And that's with people not really talking about this that much, right? So like, what are those numbers really? They're big. They're big. According to Medscape, 1 in 7 women are experiencing chronic pelvic pain. So that's pain that's lasting greater than 6 months. And they anticipate that these numbers are actually pretty similar in men. Pelvic pain is really poorly understood, and thus it's pretty poorly managed on a Western medical stage. Many of these clients have associated health problems like sexual dysfunction, bowel and bladder dysfunction, fertility issues, orthopedic issues with some of those concomitant tissues, some systemic symptoms, and also mental health symptoms. Outpatient physician visits for chronic pelvic pain cost approximately $881.5 million per year. So what does that mean for us as acupuncturists? Well, I think that this means there's a big opportunity for us to help these clients. And the chances are many of these clients are already coming into our practice. They're already clients that we're seeing, right? Maybe they're coming in for some GI distress. Maybe they're coming in because they hurt their wrist and, they want to play tennis. But bringing pelvic care in allows us to go deeper into the systems of the body. And by going deeper into the systems of the body, we can really, really support our clients and really help them with things that are affecting their quality of life. Speaking of quality of life, here are a few studies done specifically on pelvic floor dysfunction or pelvic pain and quality of life. So first off, women who have had a pelvic floor dysfunction or symptoms of pelvic organ prolapse or colorectal anal symptoms or any kind of urinary symptoms have a worse perceived quality of life in all dimensions that were covered in this study. And of course, prolapse symptoms have the biggest impact and emotional component of quality of life in all the affected subdomains. So what that means is any of these pelvic conditions are going to impact quality of life or perceived quality of life based on client report. And prolapse essentially has the biggest impact, is what this study is saying, which makes a lot of sense. Having prolapsed organs is a daily concern every time you're using the bathroom or every time you're doing an activity, right? Pelvic floor disorders such as urine and fecal incontinence and pelvic organ prolapse are stressful, annoying, chronic conditions that affect the life of millions of women and men, although this study was just on women, of all ages in the world and lead to considerable impairments in quality of life. Another study provided insight into actually self-management strategies for different aspects of challenges faced by women with pelvic floor dysfunction. So these women try to resolve or conceal or modify or control aspects of their life to try to accept and tolerate their disease. That's really unfortunate, right? That the message to clients who are experiencing some type of pelvic pain or pelvic dysfunction, or men who are experiencing some type of pelvic pain or pelvic dysfunction is like, here's what you need to do. You need to just accept, right? You need to just accept and tolerate that this is part of your life. This is part of the aging process. And I don't think that's good enough. I don't think that is a reasonable expectation. And I think we can help as acupuncturists. So for men, erectile dysfunction, as we know, is a major chronic condition that can have substantial implications for well-being and quality of life for both the affected individual and their partner. Now, most of us we know, most of it seems obvious, but the fact that some research studies have actually been done already to demonstrate quality of life impact with pelvic pain and pelvic dysfunction just tells us that there is a need for these clients to have treatment out there that supports them in all ways. So there have been a few, not many, but there have been a few studies done by acupuncturists already, research studies, that really can help to demonstrate how much acupuncture can be helpful, right, for clients with pelvic pain and pelvic dysfunction. So acupuncture combined with rehabilitation is effective for chronic pelvic pain syndrome in females, which can significantly reduce the pain intensity and improve the pelvic dysfunction. So acupuncture improves pain and helps to improve the dysfunction. That's amazing. right? We're already on the right page. We're already providing support that doesn't exist. In conclusion, the combination of warm acupuncture and Kegel exercises has been found effective in enhancing pelvic floor muscle strength, restoring pelvic floor muscle anatomy, and improving pelvic floor function among postpartum women. So this is another great opportunity to combine acupuncture with our heat modalities with some exercises for your clients. In a study of 173 publications, it was found that acupuncture on chronic pelvic pain syndrome is increasingly valued and recognized. I love this study because it was like, yay, acupuncture. And there aren't that many of those out there. So this was a really exciting one. Finally, this last study that I have, acupuncture intervention effectively helps chronic pelvic pain patients on their pain management. So the various methods of acupuncture have higher treatment efficacy than Western medication or TCM medication. So they actually did herbs and they did biologics, and they found that acupuncture itself was more effective. Now, they did not do acupuncture with the TCM herbs, which I imagine might be more effective. I'm not a specialist in herbs, so I can't speak to that. But I would expect that that would be certainly part of the combination, right? The monotherapy of acupuncture had a higher efficacy for pain management also than control interventions for chronic pelvic pain, as well as the recommended adjunctive therapy. So this is really, really important. These studies are the foundation for bringing pelvic care into the standard of acupuncture practice. And I really love this. And I think it's so necessary for those of us who are already specializing in these fields. And you can take that to whatever, we're famous in acupuncture for kind of weaving our way in to connect all the dots in whatever way, because we can explain anything, right? But in whatever way, if you're someone who treats a lot of back pain, oh, well, you can add pelvic pain because back pain and pelvic pain are often connected. If you treat women's health, pelvic pain and women's health are often connected. If you treat pregnancy, pelvic dysfunction and pregnancy or postpartum are connected, right? So there's a lot of different specialties that really make sense for bringing pelvic care in. And I think it should be standard. All right, so 10 signs that your client already needs pelvic care. Chronic pelvic pain, it's obvious, but you know what? Not every single client is going to tell you that they have pelvic pain. You have to ask. And so if your client is coming in, let's say with back pain or something like that, that's a perfect opportunity to ask, oh, do you happen to have any pelvic pain, on the anterior pelvis, or do you have any pain when you're sitting down in your sit bones, anything like that? And then kind of bridge that into, how deep does this pain go? What's the pain story here, or what's the dysfunction story here? Menstrual irregularities, fertility challenges, postpartum recovery, urinary or bowel frequency or incontinence, of course, GI distress, menopausal symptoms, stress and anxiety, recurrent reproductive health issues, and of course, musculoskeletal pain in the pelvis, the abdomen, the hips, or the low back. When we're talking about GI distress and we're talking about musculoskeletal pain, the overlap between either of these and the pelvis is enormous. I find so often that if I'm treating someone for GI, that there is very, very often a correlation with pelvic pain or pelvic dysfunction. And sometimes, even if there's not a correlation that the client perceives, there is a correlation, and the pelvic floor can really serve as an unlocking mechanism to help the GI system. And in particular, that coccygeus muscle that I told you was like my magic little muscle here, this guy makes wonders for those with GI dysfunction. All right, so let me know in the chat, do your existing clients need pelvic care? You can throw some emojis in, some thumbs up. If you're not sure, throw some question marks or exclamation points, whatever you want. I want to know how your clients are feeling here. Jessica, yes. Jessica R says yes, for sure. Michelle says yes, for sure. Beautiful. Yes, thumbs up. Thumbs, 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 thumbs. It all starts in the gut, Keith. Yes, it does. 100%. Yes, yes. They need it and they don't even know it, James. Yes, that is 100% true. Yes. All right. So we're all on the same page here. This is awesome. So you're right. They need it and they don't even know it. And you know what? Not every client is going to be open to pelvic care right away. Some are. Some, once you release this into your practice, some are going to be like, yes, 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 I'm ready, let's go, right? And others aren't going to have that same mentality. And it's about 50-50. So, of course, our job is to maintain our ethical boundaries and our integrity as a practitioner, but also to gently educate clients and share with them some of these benefits and share with them some of your success stories and some of these research studies that are out there, right? So, what can adding pelvic care do for your practice? Well, every acupuncturist, I think, that I've met has been someone who is heart-centered, has been someone who loves with their whole heart and presents that way with their clients. And we love helping clients to impact their quality of life in a positive way. And we're also really good at meeting them where they are, right? If someone comes in a wrist and it's just a wrist, right? And they come in for their wrist, they're a tennis player, and then they go after 6 visits because their wrist is better. And maybe they come back 2 years later for their knee, and that's kind of their max. That's where they hang out, and that's okay. We treat those clients, we meet them where they are. And then we have the client who came in for their wrist and they want to play tennis and they realize, oh my gosh, acupuncture changes my life, like in all ways. You treated my wrist, and all of a sudden I'm feeling better in balance with myself. I want to keep coming. Can I just keep coming to acupuncture because it feels really good and it keeps my mind sane? Yes, you can, right? And so with those clients, maybe there's more depth. And that's okay. We're not here to judge where anyone is at, but we can really make an impact on quality of life by supporting these clients at whatever level they're ready to achieve. We've already demonstrated the research that shows that quality of life is directly linked to pelvic health. As acupuncturists, we're already great at pain reduction, enhancing sexual function, improving urinary and bowel function, hormone balancing, better digestion, and more, right? This is just like, the cherry on top of the ice cream sundae. A focus on pelvic care is helping you to bring your foundation of practice to the root of the body, which I really love, right? What's the root of the dysfunction? Maybe it's not always the pelvis, but it certainly can be in a lot of cases. This helps us to diversify your clientele. So adding a new specialty is going to bring new clients through the door, which is always a good thing. It's going to bring former clients back as well, right? Like all of a sudden you send out an email blast, hey, I just got certified with my advanced certificate in pelvic care. And all of a sudden you get 10 emails from clients who are like, hey, I saw you 5 years ago and, I've got this pelvic dysfunction. I'd really like to come back. Or, hey, I was pregnant. You really helped me through that, but postpartum things aren't working out right. Can I come back? Yes, you can come back. Bring those clients back in. And it opens the door for, as we've talked about, these conversations with your current clients, right? Even if they're just on the edge of like, okay, this is a safe space where I can talk about my pelvic issues, even if I'm not ready to be treated yet as a client, right? This helps you to add wellness programs. So you can add packages. For example, if you're really, really into herbs and supplements and that's your jam, from the hormone balancing level, from the tendinomuscular level, whatever your jam is, you can create packages of like 10 visits for pelvic care that include supplements, right? So that's not just going to be beneficial for your bottom line. That's going to be really beneficial for your client because your clients are then able to have the totality of support with them. You're going to give them their exercises through that process. You're going to work with the layers of the pelvic floor. You're going to work with the layers of the back or the abdomen, whatever it is that the client calls for. And they're going to carry over from visit to visit. They're going to do their homework because they're invested in what you're up to, right? You put a price tag on it and they pay that big price tag up front. That's going to be consistency of care. And that's important for pelvic health because a one and done is not going to work here. You can do groups for your community, which I really love. And these can be like intentional or educational or energetic healing. This gets your name out there, but it also helps you to help larger numbers of people, because sometimes we're limited as to what we can do with one person on the treatment table. Also, collaboration, collective, community. You're now part of another community. This is great for referrals, but it's also great to not go it alone, right? Having a pelvic floor PT, in your neighborhood, in your back pocket, having a gynecologist that's holistic, having a urologist who deals with erectile dysfunction on the holistic side, all of these things can become part of your community. And that's really important to build, who we are as practitioners and how we fit in the world or our community. All right, so you already have a lot of tools in your toolkit. You can do a TCM diagnosis. You can do general acupuncture. You know ashi points. You might know spirit of the points or 5-element acupuncture. You know moxa, gua sha, auricular acupuncture, herbs and supplements, Chinese nutrition. Maybe you're a specialist in qigong or breathing exercises, right? You already have a lot of tools in your toolkit. The question is, how can we put all of this together? And if you take anything from today, take what it is that your specialty is and look at that through the lens of pelvic care. And I'm sure something is going to come to you that is a tip or a trick that is going to help start these clients already on their journey toward healing the pelvis. So what's my treatment approach in totality? Okay, so I do a full evaluation. My full evaluation includes a very comprehensive medical history that I have the client do before they come in, and then we review it together. I also include the PFDI, which is the Pelvic Floor Disability Index. Of course, I take pulses, I do tongue, I come up with my TCM pattern or patterns, and I do a orthopedic and structural diagnosis as well. So that's kind of my first day evaluation. Sometimes I'm able to also, I was trained as a 5-element acupuncturist, so I am very much into the belief system that clearing possession, clearing aggressive energy, clearing blocks in the pulses, CVGV block, Spirit 24, Kidney 24 block is really, really important to provide a foundation. So sometimes I can wrap all this into one session. Sometimes I can't. If it's a new client that I've never met before, usually I have to break this up into 2 sessions to get used to working with them. Then next, what I do, if this is a new client, I'm going to use techniques that might be a little bit less invasive. So I'm going to support their constitution in the best way that I can come up with, whether that's spirit of the points or whether that's TCM, sort of depends on where the client lands and how you practice. If you're really into auricular acupuncture, this is a great way for the client to get to know how you needle. You might not be able to make a impact on the pelvic floor right away, but you're going to change the mentality. Changing the mentality, creating that foundation is going to be super duper helpful for going forward with this client, right? We need them to trust you. Then I like to start with the structural work, and I use the ashi points of the connecting tissues before I go into the ashi points of the pelvic floor. Okay, and this methodology has been very, very effective. It works simply because we have to start unlocking piece by piece. Those pelvic floor muscles are a lot smaller than the pelvic floor, than the muscles of the back, than the muscles of the abdomen, right? So we want to start working with those and bringing in our spirit of the points and bringing on our TCM to then help that client to get deeper into the layers of the pelvic floor. We want the chi to start moving before we're just needling in there for, no reason or getting a minimal effect. Once we've done that, the back, the abdomen, the hips, we go deeper into that anterior pelvis, right? Going into that iliacus, going into the QL. So getting really into those deep muscle tissues. Then we go into our pelvis. We do our structural work, our manual therapy, and our needling of the pelvic floor, and we support that with the points that we would already be doing. We can do our sinew work if that's your thing. I love that. That's one of my things that I do a lot is getting the sinews involved. And then we kind of keep progressing the treatment. And the way that we want to be objective in our measures is utilizing that PFDI, the Pelvic Floor Disability Index, using the pulses, using the tongue. That allows us to be objective with the client as well as their symptom profile so that they can also be aware of the progress that they're experiencing. And you want to celebrate the wins. You may have to ask every single time, like some of your clients are not going to say, oh my gosh, I had sex without pain for the first time. Some clients are going to be like, yeah, you're never going to believe what happened. Let me tell you all about it. And other clients, they're not going to tell you that until they ask. And then you're like, okay, is this something we should be celebrating? They're like, with their little shy smile, like, yeah, I think we should. I'm really excited. Where do we go next? So these little wins are going to be so big for your clients. All right, I promised I was going to give you my number one tool to help your clients today. All right, so if you are seated in your chair, what you're going to do is you're going to rock, and you're not driving. You're going to rock your pelvis back and forth. So just kind of anterior tilt, posterior tilt on the pelvis. And as you do that, you want to feel into the pubic bone and you want to feel into the tailbone. Okay. Then you're going to go side to side with the pelvis. As you're going side to side with the pelvis, you want to feel those ischial tuberosities. So the pelvic floor is going to exist between the pubic bone, those two ischial tuberosities on like east and west, and of course the tip of the tailbone. So you want to feel that tissue. What's that tissue up to, right? And then just kind of get into your breathing, relax a little bit. As you take a nice big inhale, I want that inhale to feel like it's a balloon. I want everything to expand. So your lungs expand in your rib cage, your abdomen expands, and your pelvic floor expands. You can even feel that breath going into that diamond, that hammock of the pelvic floor on that inhale, right? And then on the exhale, squeeze that pelvic floor, close the holes, squeeze it up and in. That's it. And then you're contracting the abdominal muscles, contracting those muscles of the rib cage to really push that breath out on the exhale. And again, why are we doing this? On the inhale, we're expanding like a balloon. On the exhale, we're contracting up and in. Well, that's because on the exhale is when the majority of our clients are going to be experiencing their leakage. Okay, so think about that. The sneeze, the cough, the laugh, those are all exhale type movements, right? So if on the exhale, the pelvic floor is relaxed, what do we think is going to happen? We're creating abdominal pressure and the holes are all open. Stuff's going to come out. It's just what's going to happen, right? So on that exhale, we want to retrain, help our clients to retrain their brain so that on exhale, we've got that squeeze up and in, and on that inhale, we're relaxed and we've got that balloon experience. If you can spend some time just playing with the pelvic breath, that's going to be something that is so, so helpful to your clients and to your own pelvic health as well, because now we're retraining that kinesthetic awareness. We're getting you in contact with your body and with your own pelvic floor. And that's the key to starting the healing process. All right, so really quick, I'm going to go fast through these lifestyle recommendations so that we have time for questions. You can instruct your client in the pelvic breath, right? I just gave you the example of that. That's your number one. That's your go-to. You want to encourage your client to avoid straining when they're using the bathroom. If they're pushing really hard when they're using the bathroom, that's not going to help the pelvic floor. That's going to teach and train the pelvic floor to be in an overextended state. Drinking half their body weight in water, avoiding the restriction of water, even if leakage is an issue. This is a big, big one. Having your client consider using a squatty potty, which again helps with straining of the use of the bathroom, right? The purpose of the squatty potty is to put the puborectalis, which is this guy right here, that muscle, that medial lane closest to the external anal sphincter. It's going to put that on slack so that the rectum can empty all the way, right? And we don't have a pinching happen. If you haven't watched the squatty potty video with the unicorn doing the rainbow poo, I definitely recommend it. Also, squatty potties are just very useful. Promote daily movement like Qigong or yoga, and you can actually encourage your clients to limit their heavy lifting until their pelvic floor symptoms improve, because this is going to be an area that really strains the abdominal cavity, strains the back, and puts excess strain on the pelvic floor. Avoid sitting in any position longer than 20 minutes. Have them get up from sitting, do a little stretch, do what feels good, twist their body, do a little, gate of life opening, Qigong, whatever works. get them standing up, get them moving between sitting. Recommending a foam roller, self-massager, using one's own hands to massage the hips, the glutes, and even the pelvic floor. Nutritional recommendations based on their pattern. You probably already know these. Providing herb and supplement recommendations based on their pattern. You know these. Have your client keep a journal and mentally monitor the symptoms in relation to their activities and their hormonal cycles, as well as their stress. This is key. If they're journaling about this, you have information as their practitioner, and they have information as well that's going to help them to identify the culprits of their worst times of pelvic floor pain or dysfunction. And then finally, we need to help the client to understand that working on the pelvis can bring up emotions. And we want to encourage them when they can, when it serves them, to lean into those emotions, and also lean into the support that they have in place with acupuncture, other healthcare providers, with friends, with family, etc. Emotions in the pelvis go hand in hand. They're linked together and united. All right, so you have made it to the end of my webinar. If you've made it to the end, you get a special offer. It is valid for 24 hours. We are offering $500 off our Pelvic Care Advanced Certificate using the coupon code Michelle Love. We're also offering, just off the online modules, $300 off the Pelvic Care Online, and that's coupon code Michelle Chi. Caitlin's going to put these into the comments for you so that you have them accessible to you. And then $100 off of our live practical, which is going to be Michelle Live. So those are the special offers. They're valid for just the 24 hours. So if you want to jump on that, this is a great time to do that. We are going to have a sale that goes for a full week. But if you already know this is the moment to sign up, you know that you can meet us in Florida in November, or up in New Hampshire in October, let us know, send us a message, and use the link, buy your classes now. And then that's a wrap. So let's go ahead and throw lots of emojis and gratitudes and comments for Michelle for hosting us, because this would not be possible without her, into the comment section, and then we'll get into your questions, okay?
Oh, thank you. Thank you for such a fabulous presentation. I learned so much. I took a lot of notes. I kept an eye on the chat, and we did have a couple questions. So I was thinking I could ask you the questions from the chat, and then if anybody wanted to raise their hand and ask more questions, we could do that. Or I have a few more that we could ask. And thank you again, everyone, for being here. I know we're a little over 1 o'clock. If you have to go, please know that I will send you the video replay and the slides and the links and the discount codes. And someone had asked if the Instagram handles would be included. So yes, they will be in the chat, which I will also send you. So you will get everything. So the first question that came up in the chat was from Anne, and she said, can you address dryness in peri and postmenopausal women?
Yes, that is a great question. And that's a little bit of a rabbit hole type question, right?
Fair.
So first off, we need to know what's happening with the fluids in the body. What's happening with the fluids in the body could be a combination of a few different patterns, but we want to know if there's cold or we want to know if there's heat, right? That's going to be our first sort of lens into the dryness. Let's make it simple. When I'm confused about something, I always want to simplify, right? So is it heat? Is it cold? Is this an internal condition? Is this an external condition? Are there other concomitant conditions or medications at play? Because that's often something that's coming up as well. I very often see a client for either vaginal dryness or erectile dysfunction, and they are on 4 medications that contribute to their dysfunction, and their Western doc doesn't know why. And it's like, okay, well, this is going to be a factor. Now, they might need to be on those medications for some other reason, right? That's not our expertise. We're not going to get into taking them off their blood pressure medications. That's not our job. But we want to be aware of that, because there's only so much we can do. So we want to know how much we can combat with what's happening, and then also provide solutions that are going to work with that client where they're at. So maybe some of those solutions are going to be providing recommendations for natural lubrication, right? Maybe some of those solutions are going to be using a pelvic wand for a female, using a pelvic wand to work out some of the trigger points that exist within those pelvic floor muscles that they may not actually know about. And if they don't know about those trigger points, right, a trigger point is going to create a spot of stagnation. Anytime we have stagnation, we're not going to have good chi flow. We're not going to have good blood flow, and thus we're not going to have good fluid flow. So there's so much that we can do with, right, what's happening with the fluids of the body and lubrication. I hope that this started to touch on your question. I realize it might not be a total complete answer, but I think it could be a whole 1 hour lecture on its own.
Yeah, I'm sure. No, I think that was great. And I would assume that that is a topic that you probably dive into in your certification among many other
Definitely.
topics.
Definitely.
And then Yulia had asked, I don't know if you'll be able to know the answer to this, but are there health insurances that cover pelvic floor patients? And I'm assuming she meant for acupuncture.
Yeah. So I don't know. I actually do not take insurance in my practice, and I'm sure it varies state to state. So that I don't know. I do know this. HSAs and FSAs, I think is what they're called, are very flexible for acupuncturists treating the whole body. So I have had a lot of success with clients using their HSA and their FSA to treat whatever it is. So if they're in for their back pain and their pelvic floor is part of it, it's no problem. They don't need a second diagnosis. They don't need any of that. They're just able to kind of use the funds how they choose to. And generally, I hear that insurance companies are a little bit more like that for acupuncturists than they are for PTs, but the visits are generally limited to like 12 a year. So I guess that's another soapbox that we could jump on, but not today.
Okay. And then Yulia also asked, how long is each appointment for you typically, and how many to see results?
Oh, this is a great question. So my practice is a practice. I have 2 rooms and I see clients. I have like 90 minutes per room. So that means I see a client at 9, another client at 9:30. My next client doesn't come in till 10:30. So what that does is it allows me to have a lot of hands-on time with my clients. So I'm not juggling 15-minute treatments. I spend a lot of time. The pelvic floor, to needle the pelvic floor, if you're doing that, you actually have to needle in sideline. You can only needle the side down to start with, and then you have to flip the client over to treat the other side. So you can expect right there that these treatments are going to be a bit longer than your general treatments, even if you're combining some of the orthopedic stuff in. I would say it's hard to say like run 4 rooms and specialize in pelvic care. I don't think that's going to be an easy thing to do. And number of visits, sorry. I generally will see clients just by the integration of like clearing the blocks in session number 1. They're like, oh my gosh, I feel so much better. And it's like, well, what about your pelvic floor symptoms? And they're like, oh, I didn't notice I was getting up to go to the bathroom as much at night. And it's like, oh, okay, that's great. That's an awesome start, right? And then it's like by visit 3 that we're really starting to see things coming together. And that's without even needling the pelvic floor.
Mm,
So it makes a big difference to work on those concomitant instructors.
amazing. I can put it out to anybody who's still here. If you have a question, if you wanted to type it in the chat, if anybody feels really brave and they wanted to turn their video on and ask their question. I'll give everyone a minute to think about it. I had a question. So this I think is a simple one. So you mentioned there was a ligament that was very useful for when people have SI joint pain. And what was the name
Yeah.
of the ligament?
It's called the sacrotuberous ligament.
Oh, okay, gotcha.
Yep.
Sacrotuberous ligament.
So sacrotuberous connects the sacrum, right, to the ischial tuberosity.
Gotcha.
And if you go to palpate the sacrotuberous ligament, it's going to feel round under your finger, and you'll feel that it is taut, like very taut compared to the musculature underneath, or very soft compared to the musculature underneath if there's an imbalance side to side. So it's a great ligament to check. Yeah.
Okay.
And you can
Thank you.
palpate that in prone.
Okay. And then it looks like Betsy has a question. Do you think
Mhm.
it would be reasonable to continue treating 2 patients per hour if I bring on this specialty once patients have had their initial visit?
It depends, that really depends on like your style of work. I think if you're not you're not someone who uses moxa or uses gua sha, uses manual therapy, that kind of thing. I really like that extra half hour just because it does allow me, if I want to add in moxa for some reason, if I didn't do it up front and I want to do it at the end, it gives me time to do that. So I really like that. I also think when your expectation, when you bring pelvic care into your practice, you might want to give yourself more time initially because it might be necessary for you to help kind of sort your own brain out and really figure out what's going on so that you can do the best job for those clients. And then as you figure out how you work with pelvic care as a specialty, then you can, contract that time a little bit.
And then Heather has a pretty specific question. I don't know if maybe it would be easier for you to contact
Mhm.
her individually. Can you speak to the jaw diaphragm pelvic floor connection and some of the TCM behind that? It feels complex.
It is complex.
What a good
Yes.
question.
That's a great question. And that could be its own lecture as well. And that's something I'll
Fair.
definitely, kind of put something on Instagram in the next, I don't know, week or so about. But basically, if you look at the anatomy, and I don't have the slide unfortunately available, otherwise I'd pop it up. But if you look at the anatomy of the vocal cords and you look at the anatomy of the pelvic floor, there are some very significant similarities there. And so, because of the way that the similarities are, there's that anatomical connection already. And the muscle fibers are actually very similar in thickness if you do like cadaver dissection, and they have the same, that triangular kind of patterning, right? So, and of course, there's an opening, right? Um, so, there's already those similarities that just create a pattern. Now, with the pelvic floor, um, being the sort of descending, right? Everything comes out the pelvic floor mostly. Everything is kind of coming down. Things are coming down as well within the throat, and it's producing. So the way that I see it, without like going into too much, because I can get over detailed, is that we're taking in through the mouth, right? Whether that's breath or food. That's our connection to the outside. We're taking in here, and then we're releasing to the outside from the pelvis. Okay, so there's another connection there. So there's a lot of overlay, a lot of overplay. When we get into how is this connected with the liver in particular, there's even more connections you make. But I hope that this is like just a start of seeing those connections and seeing why we might see someone that has this tightening in the throat also have a tightening in the pelvis, or someone who doesn't use their voice also maybe isn't, getting into the root of their purpose in life or their creation, right? So those kind of connections on the ethereal level do come up very often.
I also really love that question. I know we had talked before your presentation that maybe dense questions like that you would like create an Instagram post or
Yeah, for
something.
sure.
So I wrote it down
Awesome.
because I think a lot of people would love a deep dive into
Sure.
that concept.
Definitely.
I think that's all the questions that we had from people. My last question for you was in your certification, I'm assuming you are teaching needling technique of all of the related points, as well as the pelvic floor, as well as palpation of the pelvic floor. And I know you have an ethics class in there. So sort of like what does it look like to palpate the pelvic floor as an acupuncturist? Like what is appropriate, what is draping, all of that sort of thing
Yeah.
is all in there.
Yeah, definitely. It's all in there. And for the most part, the scope of practice for treating the pelvis is
Mhm.
going to fall into the same scope of practice, right? As acupuncture in general does. We are manual therapists. We do needle the pelvis. The only
Mhm.
thing that we would have to be considerate about is one particular muscle, which is the bulbospongiosis. We briefly talked about that. On
Mhm.
males, we can treat that without any problem because it's external. On females, we actually have to do an internal palpation to work with the bulbospongiosis. Now, that's going to be up to your state Practice Act, whether or not that's within your scope of practice or not. Many states, mine included, says that if you're trained in this, if you feel like it's in your scope of practice, it is kind of thing. So there's nothing specific. Some states are very, very rigid and have specifics, but I mean, this is superficial muscle. There's a lot that we can do without utilizing the bulbospongiosis, right? But of course, proper draping, proper positioning, it's all in the courses. The palpation position, the needling position, all of that is in between the anatomy and then the treatment techniques and protocols class. Everything is kind of weaved in there. There's specific videos that are just demo videos.
Gotcha. Okay.
Yeah.
Very nice. All right. Well, thank you to everyone who is still here. I guess I'll do one last opportunity for questions. And if there's anything else that you wanted to share, feel free to let us know.
I just want to thank everyone so much for being here. And as I said before, entrusting me to share this information and sharing this energy to bring pelvic care into our practice. It just feels like it's such a potent moment for us as practitioners. And I'm just really grateful and really honored.
Yeah. Well, thank you. Thank you so much for being here and sharing this with us.
For sure. Thank you. My pleasure.
All right. So I will sign us off in just a moment, and I will send everyone the replay, the slides, the chat, and the links. So thank you guys. Thanks so much for being here.
Thank you. Bye.